Health officials in China are dealing with an outbreak of a viral infection called Chikungunya. The outbreak has sickened over 8,000 people in the southern part of the country in just a few weeks. So far, no signs of the illness in BC. But if you travel to China, CBC's medical columnist, Dr. Melissa Lem, has some tips to stay safe. Dr. Lem, thank you so much for joining us.
Thanks, Manit.
Now, I just want to start off by asking you, how is the virus transmitted, and can it be passed person to person?
Well, Manit, the vast majority of cases happen when the chikungunya virus is transmitted through mosquito bites, as you mentioned, in countries where it's endemic, like in Africa or South America or in China right now, or where there are active outbreaks like we've seen before in Europe. And when a person who's infected with chikungunya is bitten by a mosquito that can carry it, because not all mosquito species can carry it, it can then infect another human being by biting them. And it's also very occasionally transmitted from a pregnant person to their fetus, mostly during the second or third trimesters. And there have been a very few rare documented cases of when lab workers handling blood samples or drawing blood from an infected patient have acquired it. Thankfully, so far, we haven't seen any cases acquired locally from mosquitoes within Canada. We've only seen travel-acquired cases here. But as climate change shifts the distribution of mosquitoes, we do actually have a small population of those risky kinds of mosquitoes in Canada that could grow with time. There is a chance that down the road we could see chikungunya outbreaks here.
And Canada has issued a level 2 advisory for those who travel to those particular areas of concern in China, so Foshan and the Guangdong province. How can you protect yourself if you are deciding to travel there?
Well, the first thing I would recommend if you're traveling anywhere outside North America is to do some research on approved websites like Health Canada's website or the Center for Disease Control in the US, and consult with a travel medicine clinic about which vaccines you might need, because there are lots of vaccine-preventable infectious diseases out there that we don't have in Canada. In the case of chikungunya, you could consider getting vaccinated against it because there is an approved vaccine in Canada, even though it's not very common. And then, of course, avoid getting bitten by mosquitoes as much as you can. Use bug spray, cover up your skin with light-colored and loose clothing, cover up your feet where you don't often notice mosquitoes by wearing socks and closed-toed shoes. And then also remember at nighttime to sleep under mosquito nets, because chikungunya is transmitted by both day and night biting mosquitoes. And last but not least, be especially careful if you're in a higher risk group for a more severe disease, including babies, including pregnant people because of the risk of transmission to their babies, and then also older adults with pre-existing conditions.
And Dr. Lem, just in the case that someone is bitten, what are some symptoms to watch out for? How serious is this illness?
Well, first of all, after you get bitten by an infected mosquito, it takes an average of 4 to 7 days to develop symptoms, and there is a very high attack rate. About 80% of people infected with chikungunya will go on to develop symptoms, and it can be very serious and life-threatening, but the majority of people do recover within 1 to 2 weeks. So the classic initial presentation is a sudden, really high fever over 39 degrees Celsius with severe joint pain, often in the small joints of your ankles and your hands and your wrists, but sometimes in larger joints like your knees and shoulders. And then other common symptoms include headache, nausea, fatigue, muscle pain, and rash. Some people, unfortunately, can go on to develop joint pain that lasts for months or even years, called chronic chikungunya. And in fact, the name chikungunya comes from a word in Tanzania that translates into that which bends up, which refers to this bent up posture that people assume when they're experiencing that intense joint pain. So it's definitely something you don't want to catch.
And are there any treatments for this?
Just supportive treatments. There are currently no directed cures or treatments for chikungunya, but if you're in another country, you're experiencing those severe symptoms, don't hesitate to go to a hospital for treatment.
Well, thank you so much for those tips. That's CBC's medical columnist, Dr. Melissa Lem.